Okay. Good afternoon.
Hello, everyone. We are going to just get started in a moment. I want to give time for everyone to join and get comfortable, so we'll start in about 1 minute. Sue, thank you for starting the trend. If you are able to put your name, where you're from, if you're representing a certain center, please show that in the chat. We would love to hear from you. Okay, everyone, we are going to go ahead and get started. Thank you so much for joining us for the 2026 RAISE Summit. My name is Josie Badger, and I am the co-director along with Miriam, who we will hear from soon, of the RAISE Transition Center. And RAISE works with all of the parent centers to make sure that we are supporting both families and youth during their transition into adulthood. Today, we're focusing on practical tools and tactics for lasting impact in transition and youth engagement. So, what we have seen over the past number of years is people want practical supports that help them hear where they are. And so that is what we are trying to bring to you today and next Monday when we are having our second summit day. We want you to be able to take the tools and implement them. I'm really grateful for our speakers. I think that they will have wonderful information to share. Go ahead.
Hi, good afternoon or good morning. I am Miriam Aliso, the other co-director for the RAISE Center, and I am going to walk with you how to use some of the Zoom features. We have a closed caption provided by Zoom, so please click on the double C over there, and the caption will pop up. We also have Q&A. Please use the Q&A feature to submit questions to the presenters and use the chat box if you have any technical issues. And we have interpretation to Spanish. We have live interpretation. Para acceder al canal en español, van a ver en la banda o cinta negra un globo que indica Interpretation. Haga clic allí y luego selecciona donde dice Español y oprime donde dice Mute Original Audio. Esto último filtra completamente la señal en inglés para que pueda escuchar con claridad a nuestro intérprete de hoy, Luis. We also have live American Sign Language interpretation, and they are already spotlighted, the interpreters. But if you want to do that on your end, to pin the interpreter, hover over the video of the interpreter, and you will be able to pin it. And that's all we have for accessibility.
Great. Thank you so much, Miriam. So for a little sneak peek of today's agenda, here we are in the welcome right now. And then we're going to have two of our friends at SPAN talk about advocacy and policy. These, of course, are extremely important topics right now. And so a lot of times we get questions on what are we allowed to do? What are we allowed to say? And what's going on? And so we're going to be talking about that. We're going to have our amazing RSA Parent Centers share what they've been doing during this past year of funding. And then we will have a wrap up. I believe that this time is going to fly by. And so we are running a few minutes ahead, but I don't think anyone is going to complain if we go ahead and get started. So the first thing we are going to do is to turn it over to Diane Etienne, who has been the founder of SPAN and has been involved in our work with RAISE since the very beginning. So Diana, I turn to you.
Thanks so much, Josie. So I'm Diana Autain. I am the Senior Director for Organizational Capacity Building Programs at SPAN. So I'm the Senior Director for the programs that help other family-led, family-serving organizations be able to more effectively reach and serve families. And I was the Executive Director or Co-Director of SPAN for 28 years. And then stepped down into this role a few years ago. So I'm also an attorney, and I'm also a parent and a grandparent of now adults with disabilities and special healthcare needs. I'm going to talk about advocacy versus lobbying, and I'm going to share my screen, my PowerPoint presentation. See slideshow from the beginning. Okay. So I'm going to talk about, is it lobbying or is it not? So we're going to talk about what is lobbying, and there's two basic kinds of lobbying. So we're going to talk about both of those, grassroots lobbying and direct lobbying. I'm going to answer the question about whether or not nonprofits can lobby. Short answer is yes. I'm going to talk about the 501H expenditure test and whether or not nonprofit organizations should elect the 501H expenditure test. The short answer is yes. I'm going to talk a little bit about how you can influence policy without lobbying, what are legislative scorecards, and some ways to get funds to lobby. So when you think about any of the issues that you care about, and you see right here, I have transition, employment, adulthood, independent living, education kind of as the biggest, job support, ability as the biggest category, since this is the RAISE Summit after all. But any of these issues that you care about, whether they're related to transition to adult life, whether they're related to early intervention, whether they're related to healthcare, health coverage, all of those issues require that the policymakers who are making decisions about them have information from the people who are directly impacted by that issue and the people who help people access those services, and who know what the systems look like on the ground in practice, and who can give information to policymakers about ways that they could improve the systems to improve outcomes. And so lobbying is a way for individuals and organizations to help policymakers get information that they need to make good decisions about policy. Now, there are a lot of different avenues for advocacy that aren't all about lobbying. You'll see there's one on here that's in red, and I'll tell you why in a minute. We can organize communities. We can organize communities to do self-help groups. We can organize communities to share information with policymakers. We can educate legislators, which is different than lobbying because it's not about trying to get legislators to adopt a particular position or approach towards a policy issue, but it's just educating legislators about what's going on in the field. We can encourage people to vote. We can educate the public through forums and seminars and letters to the editor and op-ed pieces. We can do educational conferences and research. As a nonprofit organization, one of the things that we cannot do, because it is the death knell for a nonprofit organization, is engage in partisan political activity. And what that means is that we cannot support any particular or oppose any particular candidate for any elected position. That's partisan political activity. We cannot do that. Doing that makes you lose your 501c3 nonprofit status. We can lobby. We can do nonpartisan voter education. We can do lobbying on areas where there are exceptions in the Internal Revenue Service tax code, because that's where the lobbying rules come from in part. We can do skills training. We can advocate to change corporate behavior, for example, to get corporations to voluntarily recruit and hire more youth and young adults with disabilities. We can engage in regulatory efforts like trying to impact regulations after the legislation is passed, because regulations, advocacy around regulations is not lobbying. We can engage in litigation. These are, except for partisan political activities, these are all things we can do to advocate to change and improve the systems that impact the people that we care about. So let's start with kind of what is lobbying. And again, I said that there are two types of lobbying: direct lobbying and grassroots lobbying. Both of them involve communication. Both of them involve expressing a view about specific legislation. Direct lobbying is communication with the legislator or your members, and we'll come back to see what members are, expressing a view about specific legislation, or asking your members to be in touch with legislators to express a view about specific legislation. That's direct lobbying. You're communicating with a legislator, telling them how you'd like them to vote on a particular piece of legislation. Grassroots lobbying is also communication, but it's with the public, expressing a view about specific legislation and including a call to action. So what that means is you are communicating with the public, whether it's on your social media, whether it's in a newsletter, whether it's in a op-ed piece or a letter to the editor, that's intended to get the public to express a view about specific legislation, and you're asking them to express that view by having a call to action. It's important to know whether the lobbying is direct or grassroots, because the amount of money you can spend on direct lobbying versus grassroots lobbying is different. And we'll get to that in a minute. So what is communication? Communication is a conversation in person or on the phone, letter, email, fax, e-newsletter, social media, or other creative mechanism to convey a message. A legislator is any member of a legislative body, a city council, a state legislature, the U.S. Congress, and or their staff. It also is an executive when you're asking them to either veto or sign a bill that's been passed by the legislator. So that would include the mayor, the county executive, the governor, the president. So any member of a legislative body that passes legislation and their staff. And when you're trying to get the executive of the, president, governor, mayor, etc., when you're trying to get them to either veto or sign a bill, they also are a legislator. So at that point, communication with them is covered under communication with the legislator, but not an administrative body, because regulations are not legislation. So communicating with your commissioner of education or your commissioner of health or anybody that is on an administrative body or heads an administrative agency, whether it's a federal, state, or local administrative agency, because regulations that flesh out and interpret statutes are not legislation, and therefore it doesn't count as lobbying under the Internal Revenue Service Code, tax code, to communicate with those bodies about regulations. Now, remember that communication to the public, that's anybody who's not a legislator and anybody who's not a member of your organization, is called grassroots lobbying. Now, who is a member? A member, if you have formal members, then they are obviously members. But if you have members that have given, individuals that have given more than a small amount of time or money to you, such as volunteers that you may have, your board, advisory boards you may have, they're no longer counted as the public. They're counted as part of you. And so if you communicate to them and ask them to take lobbying action, then that's no longer considered communication with the public. because they're considered to be your members, even if they're not formal members of your organization. Now, what is expressing a view about legislation? So legislation is a bill or a resolution introduced in a legislative body or proposed legislation. It includes budget appropriations and taxes. That is legislation, whether that's at the state level or the federal level or at the local level, and also attempts to influence the confirmation of judicial and executive branch nominees. So for example, if you have communication about who should be the Secretary of Education or who should be the Commissioner of Health in your state, with the people that confirm those positions, that is considered to be communication about legislation. It does not include regulations, executive orders, litigation, or calls to enforce existing legislation. And if there's no budget proposal currently before the legislature, it also doesn't include calls for adequate funding for particular programs. But if there are budget proposals before the legislature and you're asking for adequate funding for a particular program, then it becomes legislation, because then at that point, it's budget appropriations where there is a budget proposal before the legislature. Now, what is a call to action? Remember, we said that if you are, it's lobbying, it's grassroots lobbying. If you are asking the public to take a particular action. So a call to action is encouraging the communications recipient to take lobbying action. That's whether they're seeing it in a newspaper article or letter to the editor or social media. You are telling them to contact the legislator. You're giving them information on how to contact the legislator, or maybe even providing a way to contact the legislator. You're identifying a legislator as being opposed to or undecided about your view on the legislation, or contacting a member of a legislative committee or a recipient's legislator. That's a call to action. You're telling them, you're asking them to contact them, giving them information on how to do it, and telling them that this person, you know, basically what you would like them to say to the legislator. Now, when we talk about ballot measures, any activity that you take on a ballot measure is direct lobbying and not impermissible electoral activity. The impermissible electoral activity is only for a partisan political candidate, and a ballot measure is not considered electoral activity. It's direct lobbying because the voting public in a ballot measure is the legislature. The voting public is the legislator. They're the ones that are going to pass the legislation. So any lobbying you do around a ballot measure would be considered to be direct lobbying and not grassroots lobbying. That includes things like referenda, bond measures, and other ballot initiatives. For example, in California, they had a ballot initiative regarding redistricting. That any activity that any organization took to support or oppose the redistricting would be considered direct lobbying. Now, when does it become lobbying? A lot of what we do includes pieces of what lobbying is. So preparation and research time in anticipation of lobbying is considered part of lobbying. Discussing public issues and formulating and agreeing upon positions and studying them in preparation for adopting a position for lobbying is considered part of lobbying. You begin measuring lobbying activity when the primary purpose of your preparation or research is to engage in lobbying activity. So it's not just the actual talking to the legislator or talking to your members or to the public to get them to reach out to legislators. It's all the preparation that goes into that lobbying that also has to be charged as lobbying. And you'll see why it's important to know that, because we'll talk about the limits, the dollar limits on lobbying for nonprofit organizations, which is based on your budget size. And so you have to be able to know how much you are spending on preparing for lobbying, as well as the time you spend on the lobbying itself. Now, say you did some research and were investigating an issue a year ago, and there was no particular ballot measure or no particular legislation that was being introduced, and you really hadn't even thought about trying to get legislation introduced, but you were trying to understand an issue better. If it's more than 6 months ago that you did that and it wasn't done specifically on purpose to prepare for lobbying, then you don't have to count it towards your lobbying. But if you did it less than 6 months ago, even if you weren't specifically doing it to prepare for lobbying, you do have to count it towards your lobbying limits. So how do you measure your lobbying activities? And the Internal Revenue Service tax code gives us 2 ways to measure lobbying activities. The first one is the 501H expenditure test. That's the one that I recommend every nonprofit organization use, even if you don't currently do lobbying, and even if you're not specifically thinking about doing lobbying. It's very simple to make that 501H election. And when you do it, it really gives you greater confidence to know whether or not you're staying within the IRS rules for lobbying. Under the 501H expenditure tests, you count all costs, including photocopying, transportation, staff time, and overhead costs aimed at lobbying. But it's very clear how much you have spent and whether or not you have gone over the financial amount you're allowed to spend. The other one is called the insubstantial part test. That means that lobbying is not a substantial part of your organization's activities, of your nonprofit organization's activities. The problem with the insubstantial part test is, one of the problems is there's no guidance on how much is considered to be substantial. It's very subjective, whereas the 501H expenditure test is very objective. So for an insubstantial part test, if you're not doing the 501H election, I encourage you to do the 501H election. But if you're not going to do that, for the insubstantial part test, you can lobby as long as the lobbying activities don't become a substantial part of your overall activities. It's a subjective test based on the circumstances and the facts of each case. And here, reimbursements to volunteers for out-of-pocket expenses spent on lobbying counts and has to be reported. For the insubstantial part test, the factors to determine whether or not it's an insubstantial or substantial part of your work include the absolute amount of time you spend, your impact, your public prominence, and unpaid volunteer work. So in other words, the more effective you are, the greater the impact you have, the more publicly prominent your activities are, the more likely it's going to be considered to be a substantial part of your activities as a nonprofit. So under the 501H test, you can be 100% successful. That doesn't make any difference on whether or not it's considered to be going over the amount you can spend, because in the 501H expenditure test, you have specific dollar limits. So here's the 501H expenditure test. So first, you only count lobbying activity that costs money. The limits vary on the size of your organization budget. If your budget is $500,000 or less, you can spend 20% on lobbying. If your budget's $500,000 to $1 million, you can spend $100,000. That's the 20% of $500,000, plus 15% of the budget over $500,000. If it's $1 million to $1.5 million, you can spend $175,000, which is first two things, plus 10% of the budget over $1 million. If it's 1.5 million plus, then it's 224,000 plus 5% of your budget over 1.5 million. for a maximum of $1 million a year. So that's how much you can spend on lobbying, but it has to be using funds that are allowed to be spent on lobbying, and I'll come back to that in a minute. You can spend a quarter or 25% of that overall lobbying budget on grassroots lobbying. So say you can spend $500,000. Say you can spend $100,000 on lobbying overall because your budget is $500,000 or less. You can spend $100,000. Only $25,000 of that can be spent on grassroots lobbying. The other $75,000 can be spent on direct lobbying. Now, under the 501 expenditure test, you can develop and disseminate a nonpartisan analysis, study, or research, or a substantive report that fully discusses the pros and cons of a particular legislative proposal without it being considered lobbying. Now, how do you make the 501 election? It's simple. The board votes to make the election. You complete Form 5768. You make a copy and you mail it to IRS. And then you start tracking your lobbying expenditures. You have to report your lobbying expenditures on your 990 form every year. And so on your 990 is where you report those lobbying expenditures. So what are some things that is advocacy that's not lobbying? Communication to your members on legislation without a call to action. You're just letting your members know that this is happening and you're not encouraging them to do anything about it. Another thing that's not lobbying is influencing regulations, administrative rules, or executive branch actions, including contact with the executive branch, the president and the administration, the governor and the governor's administration, et cetera, or legislators. Influencing school boards is not considered to be lobbying. Having a newspaper publish an article or ad stating your organization's view on legislation without a call to action is also not lobbying. And self-defense activity is not considered to be lobbying. So say, for example, there was a piece of legislation that was targeting your organization. Like we've seen some federal legislation target particular organizations, and you advocated with legislators against that legislation that would target your organization. That's self-defense activity that would not count towards your lobbying costs. Under the 501H expenditure test, you can also do a legislative scorecard. You can inform your members about how all relevant legislators have voted. That's recorded legislative votes, not campaign positions, and what the organization thinks about the votes on issues of importance to the group. Don't issue it just before an election. Issue it at the conclusion of the legislative cycle. And here in this, you can even score legislators, and it's not counted towards your lobbying expenditures. Now, what about lobbying on your own time? Staff can engage in lobbying on their own time as long as they don't indicate the relationship to the organization and are not directed by the organization to engage in the lobbying. It's very important for nonprofit organizations to have information in their personnel policies that indicate who in the organization can lobby on behalf of the organization and what the steps are to be able to lobby on behalf of the organization, and to indicate that anybody in the organization that lobbies without getting advance approval from the leadership of the organization is doing that on their own time. One of the things to keep in mind is that executive directors may be considered always on duty unless the board or personnel policies clarify otherwise. It's very hard to be the executive director of an organization and to go to especially if it's an organization that's well known in your state or territory or community, and to say you're testifying on your own behalf. But people know who you are and they know that you are the executive director of the organization. So it's really very, very difficult for lobbying by an executive director to be counted as on their own time. Now, some prohibited activities. Intervening in a political campaign of any candidate for public office is prohibited, but you may encourage and register people to vote. Engaging in partisan activity of any kind, so saying we support this party or that party, even if it's not a particular individual, that's prohibited. And you may not use government funds to lobby, including to lobby for government grants, unless Congress expressly or authorizes it. For example, developmental disabilities councils can do some lobbying with government funds. But in general, you cannot use government funds to lobby. That means you cannot use your federal government funds, you cannot use state government funds, you cannot use local government funds to lobby. So you have to find other funds to lobby. These are all prohibited. Now, it's also important to know that state and federal lobby disclosure laws also require certain organizations and individuals who are paid to lobby or whose lobbying expenses are reimbursed to register and file periodic reports on their lobbying activities. For example, in New Jersey, we have the Election Law Enforcement Commission, which requires us to report quarterly on all of our communications, not with the legislature and the government, but also with high-ranking state agency officials, which includes the commissioners, the assistant commissioners, and division directors. And even if it's not about legislation, we have to report that to our state Election Law Enforcement Commission quarterly. And annually, we have to report how much we've spent on those lobbying activities and those other activities, even ones that are intending to influence regulations or other kinds of things that are not considered to be lobbying by the federal government. So it's very important that you know what your state rules are about lobbying so that you can do that. Many states also require people to register as a lobbyist. So for example, I am registered as a lobbyist in New Jersey with our state Election Law Enforcement Commission because I do lobbying, and our state requires people who do lobbying to register as lobbyists. There's also requirements on the federal level to register as a lobbyist, but the amounts that you have to spend are generally much higher than any of us would be spending. In terms of reporting lobbying activities, there is no minimum threshold to report on lobbying activities. Even though the dollar amount may be small, you should report it in your 990 form. The IRS accepts any reasonable method for reporting, so you can do sampling instead of complete time records to estimate the time spent, as long as you can justify that sampling. You can do an estimate of the overhead costs that were spent on lobbying. They want you to do actual costs when possible. One of the tools that one of the resources we're going to share with you is a little chart that's easy to fill out to track your lobbying expenses. Now, on the federal level, there's something called the Lobbying Disclosure Act of 1995. If you have any employee that spends at least 20% of their time on federal lobbying activities, and you spend $22,500 or more over 6 months on that lobbying activity, they have to register as lobbyists under the Lobbying Disclosure Act of 1995 and file reports. This is federal registration, federal lobbying. So it has to be an employee that spends at least 20% or more of their time on federal lobbying, and you spend $22,500 or more over 6 months on lobbying. It's required under the Lobbying Disclosure Act of 1995 to register and file reports. Now, what are the sanctions if you violate the Internal Revenue Service Code requirements about lobbying? If you do not make the 501H election, then it's completely subjective test, and there's a 5% excise tax on whatever the IRS determines is excessive lobbying spending. And there's a similar tax on managers who willfully and unreasonably agree to those lobbying expenditures. Again, completely subjective test. If you elect the 501H election, it's a 25% excise tax on lobbying spending in excess of the ceiling, but it's completely objective. You know what you spent, and you know whether or not it's more than the amount you can spend based on your overall budget. And one of the worst sanctions you can get is the nonprofit death sentence. You can get a loss of your nonprofit status, of your exemption, if your spending normally exceeds 150% of either the overall limit or the grassroots lobbying limit over a 4-year period. So how can you fund lobbying? First, you cannot use government funds to influence legislation. You can't use foundation funds if the grant agreement letter prohibits it. And most foundation funding does prohibit you from using that funding to lobby. Why? Because foundations are also nonprofits, and foundations are also restricted to the same percentage of their budget that they can spend on lobbying. And if they allow their grantees to spend the money on lobbying, they're going to have to count not only whatever money they spend on lobbying, but also all the money that their grantees spend on lobbying. And they don't have a lot of control over that, right? Because they're not monitoring that their grantee day to day. There are some foundations that will allow you to use money for lobbying, but you have to make sure, you have to check your grant letter to see what the foundation says. And almost always it will tell you they cannot use it for lobbying. You can use funds generated by fee for service, contributions, membership dues, sale of materials, etc. So for example, if you do a workshop, even if it's for a government agency, but you do it as a fee for service, that money no longer is government dollars because they're paying you for a service. They're not giving you a grant, they're paying you for a service delivered. And those funds then no longer are counted as government funds. So doing workshops or technical assistance to a school district to help them improve their transition to adult life program, contributions from individuals or other entities, membership dues, selling materials. These are ways that you can fund your lobbying activities. And, for example, we use fee for service funds to cover our lobbying activities frequently. Now, there are some other options. So if you get a legislative body to invite you in writing to express your opinion about particular legislation, it's called technical advice. That's no longer considered lobbying, but it has to be in writing, and that legislative body has to invite you. So for example, a few years ago, when the Family to Family Health Information Center legislation was up for renewal in Congress, I was invited by Congressman Pallone, who chaired the committee that was over the Family to Family Health Information Centers, to come to Washington to testify on behalf of that legislation. It was a written invitation to come and express my opinion, SPAN's opinion. And so none of the costs, preparation, travel, hotel, my time, none of that counted towards lobbying because the legislative body invited me in writing to express my opinion, to provide them with technical advice on the legislation. You can also set up a 501c4, and organizations, large organizations may set up a 501c4 because there are no restrictions on the amount of lobbying. However, gifts to a 501c4 are not tax deductible. Remember that gifts to a 501c3, donations to a 501c3, a nonprofit organization, are tax deductible. So you can set up a 501c4 and you can spend as much of that money as you want on lobbying, but anybody who gives any contributions to that entity, those contributions are not deductible off their taxes. You can find information about additional limits or reporting requirements from your state association of nonprofit organizations. And if you're not a member of your state association of nonprofit organizations, I strongly encourage you to join. It's usually not that expensive, and they have lots of great information about what's going on at the state level as well as at the federal level. And you can also find out more about state laws at boulderadvocacy.org. So just some takeaway messages before I stop and see if there are any questions. You can and you should engage in public policy advocacy and lobbying because you know so much about what's going on on the ground level, on different systems and services that are supposed to benefit families and their children and youth with disabilities. And it's information that legislators really need to hear, so they make good decisions informed by what's really happening and what needs to happen, what needs to change to make it better. For most nonprofits, you should do the 501H election. It takes you less than 15 minutes. You get your board to vote, you fill out one-page form, and you send it to the IRS. And you have to report lobbying activities with your 990 tax return, regardless of whether you elect the 501H election or not, and no matter how little you spend on lobbying. So don't sit on the guidelines, get into the game. Remember that empowering family members to participate in advocacy for their children, their community, and the larger society is its own victory, regardless of the specific outcome of any particular effort. And democracy is not a spectator sport. So the tools that I've shared with Raise to share with you is At the Table, Lobbying and Political Activity Policy to consider in your personnel policies. At the Table, a lobbying report template, General Lobbying Rules for Nonprofits fact sheet, and When Does Your Activity Become Lobbying fact sheet. And some other resources, the Alliance for Justice, the Independent Sector, and the IRS, which in their charity section, which has some great information about lobbying. And so now I'm going to just stop and just see if there's any questions that anybody has.
This was really great, Diana. Thank you so much for that. If there are any questions for Diana, please put them in the Q&A, which is at the bottom of the screen. It has a little box, it has a little question mark in it. So please, if you have questions, put them there. That was a lot of information. And so you might also come back and say, oh, what was that piece? Please feel free to connect with us again, and we'll make sure to get the information to you. Thank you so much, Diana. I really appreciate it.
And you'll have access to the slides. And I tried to make the slides, really clear, and it is a lot of information, but I don't see the Q&A. I see the chat, but I don't see the Q&A feature on the bottom of my screen. So maybe I just don't have it. Yeah, no.
Might be under more? Oh, okay. Well then,
it is under more. It's under more.
Okay. Okay, great. So under more, there should be a Q&A. If you don't see it, please, for any of these panelists and presenters, please feel free to submit questions there. Sometimes it's hard to catch things in the chat, but please feel free to submit them there. Okay, thank you, Diana.
All right, so if there's no questions, and again, if questions do come up, you can share them with the Raise team, and we can talk about it, and we can answer your questions if they come up later. So thanks, everybody. Have a great rest of the Raise Summit.
Great. Thank you so much. Johan, now we are moving over to you. And so some of you might be wondering, why was this the first presentation? We know that you all are dealing with a lot. I know that families and folks with disabilities are coming to you saying, we don't know what to do, we're in trouble. And sometimes it feels like the only thing we can do is just speak up. And sometimes that is the case. And so we wanted to kick this time off with Diana because she's so very knowledgeable about what can nonprofits and foundations really do when it comes to laws and policies. But now we want to move into a little bit regarding what are the policy issues right now. I'm sure you all have heard quite a bit, and so we're going to be giving you some overall info and where to find more details. Turn it away to Johan.
Thank you, Josie. And thank you to Diana. I've had the pleasure of being able to see and learn from Diana and the presentation on lobbying at nonprofits. And every time I hear it or see it, I still come to the point where I feel like I'm learning once again. So thank you to Diana for presenting that. I think it's timely. And at the same time, I think that all of us here who are here virtually, thank you for joining, are also seeing so much change and so many policy updates coming from the administration in power right now, the White House administration, our congressional representatives and senators. There is a lot of information out there, and it is a struggle on the day to day to continue and maintaining yourself informed, depending on where you get your news and information. There's also sometimes a struggle to see where the facts lay, plus the opinions of many others. But what I have the pleasure of bringing today, thank you to Josie and the race team, is a very high level overview of information that many of you may already know or have joined many webinars and presentations now. So I hope what I can bring to you today is somewhat refreshing, if not at the very least, some resources that you may not have seen that may be of greater use to you. But all that to say, in case I have not met you or you do not know me or my role, my name is Johan Mora Valverde, and I am a project co-director here at SPAN along with Don Monaco. And I am also a policy coordinator at the Parent Center here in New Jersey. So again, a pleasure to meet you if I have not gotten a pleasure to meet you. And if I know you, it is good to see you again. So you should be able to see my screen. I want to go ahead and present on the one of the major changes that are happening since legislation from the reconciliation bill, as many of you know it in its term, the big, beautiful bill, now law. And we have seen a major change in Medicaid, particularly work reporting requirements. There is a final rule that RAISE and other nonprofits, including Parent Center state agencies, have either presented on. I've seen presentations from Community Catalyst, I've seen Family Voices, I've seen other pagers and explainers, excuse me, from Pacer and so on. I can continue naming it. But it is important to continue sharing this information on how impactful this final rule will be for our populations and for many of us, family and friends. The interim final rule that was issued by the Centers for Medicaid and Medicaid Services, I want to just focus on this diagram here that I included in the slides, and Miriam will share out as well and has shared on the RAISE website. But June 1st of 2026, we were expecting, coming from language in the reconciliation bill, that there would be a rule for adults who are enrolled in Medicaid expansion. And this rule is on reporting requirements and reporting on whether or not they are able or unable to work, all right, and at least document at least 80 hours per month of work education or community service starting in January 1st, 2027. The rule itself redefines medical frailty, and it requires a very strict proof that has pushed states with a very short deadline. Just to give you a quick timeline, from the bill to law to the final rule, many of these states have at least 7 months to enact what is required from the Medicaid work reporting in Medicaid expansion. Now, the diagram here is just very quick. It is from the National Organization for Rare Disorders, or NORD and ORD. And it is after the guidance was issued and the final rules issued. And there's examples and a small diagram that you can use. Again, I'm going to go into the next slide shortly. But I just, in case you haven't seen this, it has been helpful for myself as well as some family friends that I've shared with, to get an understanding of how this rule may be impactful to you and others. One of the major points that I wanted to bring up is the stricter proof for all of us here. If you have seen the information, if you have seen or read the rule, if you have read the requirements, you'll know that having a diagnosis is not enough. And that a medical condition under this rule means that a person's ability to work must be significantly impaired. And it leaves a lot of this definition or this stricter proof, a lot of the administrative burden, a lot of the requirements, a lot of the dissemination of information of how this may impact those enrolled or new enrollees up to the individual states to decide how strict it is and how they would share information. And also considering how there are about 7 months to the deadline, how they will receive the information and so on. And one of other major changes is the self-attestation, which means that a person's word or a patient's word of having a diagnosis, having a disability is just not enough. And January 1st, 2028, states can only accept that exactly once. Now, a lot of states have made particular changes, and we're seeing that there is not only public comments and other actions that you can take, state level coalitions that you can take, but just to just focus a little bit about what this means on why or how states may accept self-attestation is that there is no reliable information available to the state from this federal guidance, which means they have till January 1st, again, 2028, to accept it only once. And then they must at least verify that at least every 12 months. And again, we have seen, we know, we have explained to families, for many of those who have been in the advocacy world and has seen that work reporting requirements are not effective. We're also seeing now that states are also struggling to catch up as to how to apply and implement these changes. Now, I put a very quick list here of you are exempt from reporting if you're under 19 or over 64, pregnant, receive SSI, SSDI, Medicare, Social Security implementation income, disability income. If you already met SNAP and TNF work rules, and recently incarcerated individual or a caregiver for a child under 14. I would just say this is not an exhaustive list. What I did is I included, and I hope you can see it once it changes, if not, put in the chat if you don't see it, but the American Association of People with Disabilities included a Medicaid work requirements, frequently asked questions, which I've referred to plenty of times now. And you can see a more exhaustive list of those who are covered by the exceptions. So what you see there on the slides are not exhaustive, but I do ask that you go to the link that I included in order to find more information. It also gives you a definition from these changes and the interim final rule. We have seen a lot of question on what exactly is the Medicaid expansion population. So just to repeat, it is listed here in the FAQ and other good questions to ask and also share if you are doing some advocacy efforts on yourself, which is why I'm thankful for Diana's presentation, because for many of the parent centers here, it has been hard to balance, one, taking advocacy and understanding where your advocacy may fall into lobbying at your state level or a parent center. From this rule, we are asking and have seen many organizations take action, and at the moment, it is still open. There is a public comment window. When there is a rule issued via a government agency, they issue also a public comment window period, which means you are allowed to, I put the link in here directly as well. And I'll show you, now I'm going to click on everything here, but you are able to go into a portal that will shift you and allow you to write any comments, anything that you want in response. I received a question as well asking that, you know, if this rule is final, if this rule is going to take charge and states are already implementing any changes, what is the purpose of submitting a comment? it is still very important for you as an individual citizen to share how a rule that's issued under a government agency may impact you. And one of the major points for myself is that comments left on a regulation may inform future rulemaking processes, which may be things that future administrations, as well as representatives and sitting U.S. senators, may also refer to when there are new congressional bills addressing the matter of fact on Medicaid or Medicaid expansion and so on. You also have, and it was mentioned in the slide before, or the presentation before from Diana, that there are a lot of actual alerts that you can share. If you haven't, it is hard to see. Many of us here have not engaged in an action alert on the rule from CMS, have not engaged in the definition of work reporting requirements, which impacts everyone who is enrolled or new enrollees, as well as the policies under the reconciliation bill that we have seen may be costly to states as we're looking at things as data matching and other systems that have to either change, catch up, or be invested by states that do not have the ability to make these improvements in just a couple of months, even in a couple of years. So there's a couple of email templates here that you can fill out and you can send out. And I just want to move on to the next one and show you something that may be new to you. This is where I really want to focus a little bit more of my time. There is a state-level Medicaid expansion policy tracker from the Kaiser Family Foundation. The foundation itself is center, it's non-biased, which means that it is nonpartisan. However, I have used it, and just to go back, a few of the takeaways from this tracker. Early implementation, the federal start date is January 1st, 2027 to these work reporting requirements and other parts of the rule, but states can launch early, and we have seen, as I checked in last week, that states like Montana, Nebraska, and Iowa are launching right now in 2026. And there are more information on the look back period. The look back period is to see how much paperwork families need. Most states require 1 month, but we are seeing states like Indiana and North Carolina requiring at least 3 months of continuous proof on these requirements. And then the hardship exceptions as well, which I'm just going to show you. But this shows if your state will pause work rules or help protect a young adult if there's a crisis, hospitalization, medical travel, or local high unemployment, which are hardship exceptions that an individual can take depending on your state. So just to open that up, everything I linked here, I like to open up just so you can all see it. So it's not something you can discover on your own and have questions. But here's the tracker. It was last updated June 29th, 2026, and they continue to update it as they receive new information from different states. For example, in this tracker itself, you have a general overview of the work requirements and other information that has been either a graph of the United States, you can see here, but this is just a 44 states that are subject to Medicaid work requirements. And what I want to show you is the state and national data and policies, which may be helpful to you. So I'm going to go ahead and go to a random state. I chose Nebraska earlier, so I'm going to continue to that. So if anyone here from Nebraska, a quick overview if you haven't seen it, but you'll see how many of those are enrolled. And this data is from June 2025. So these numbers are subject to have changed. Renewal outcomes, March 2026, 80% of those individuals whose eligibility was redetermined. The work status of those 62% of Medicaid adults subject to work requirements, that was 2024. But you can see other policy decisions related to the state and local specific down here, which is the part that I find myself more beneficial to know. But you'll see in Nebraska, you'll see the plan implementation date and that it's May 1st, 2026, even though the federal start date was January 1st, 2027. Jen Miller, good. I'm glad. And compliance check frequency, application look back period, renewal look back period. You continue to go down, not to exhaust everything that's here. But one of the major changes that I've mentioned already, but just to go back to, is data sources and medical frailty verification. Many of these states, since they no longer can depend on an individual to say that they're to put a claim or an oath to diagnosis to saying that they're an individual with disability, they have to find and implement new ways to verify their work and exemption status. You'll see even in Nebraska, it's to be determined. The new data sources have yet to be determined as well. They have a definition on the state level. And for many of these states, again, it is not as easy to just go in a portal and verify whether or not an individual has a disability or is exempted from these work reporting requirements. Some of them don't even have the infrastructure to do so. The other thing here, and it's a good way to sort of go on into the next part of the presentation, is whether or not states, so specifically for this one, Nebraska is planning to use artificial intelligence, and or whether or not when it comes to data matching, or if they're looking for vendor contracts to update their systems or to boost eligibility for staff capacity. You see a lot of this is not applicable, but they're reporting on in order to help them with the Medicaid and Medicaid expansion. And then you can see a little bit more going down of information per state of those who are traditional enrollees and expansion enrollees and so on. So let me go back. And again, just to look at the tracker one more time, you can see that all states are here. Going locally to our state in New Jersey, you'll see that there are pages. A lot of states have already either updated their human and health services state agencies on the changes that are coming for people to access. In New Jersey, it's been updated in multiple languages because of a language access law that requires agencies to put out information such as this and essential information in more than 7 languages, depending on the census here in New Jersey. What rules are changing? There's an explainer here in the state. You may find this in any of your states if you look up your state name plus Medicaid, state name, Medicaid, work reporting requirements, and in order for you to find information that is local to you. And you'll see here under New Jersey, Medicaid is referred to New Jersey Family Care / Medicaid. You'll see that many of the changes have been updated in order for them to understand what they need, what are some exemptions, and so on. And New Jersey is one of the few states that I've seen this yet. But again, if you're doing some local coalition action, if you are connecting with your U.S. representatives, you're connecting with your state representatives, state senators, and your commissioners at the Health and Human Agency, talk to them about creating either checkers, creating verifications. In New Jersey, they've developed and created a verification to see if the rules that are coming down from the Centers for Medicaid and Medicaid Services apply to them, and they can go ahead and use this verification to screen what may impact them as a whole. Okay. Moving on to the next thing, we're moving on to shifting special education. This has been, I mean, again, there's so many changes happening. It was hard to focus on the 30 minutes on what exactly I can bring to the table here today. But shifting special education last week, many of us were on or have joined or have shared space in the U.S. Department of Education overview of these interagency agreements. The plan now is to move the operations of special education and rehabilitation services, which grants such as RAISE, the Parent Center, Community Parent Resource Centers, Parent and Training Information Centers, are currently receiving technical assistance, belong under and receive their federal funds from, to the Department of Health and Human Services and the Office of Civil Rights to the Department of Justice. Now, I just want to mention, according to federal law, these programs are required to be a part of the Department of Education, and only Congress has the authority to transfer them to another department. So if you click this, once again, you can see the resource. You can see under the section where it states specifically where these services need to be maintained. However, the Department of Education under a interagency agreement, which we're seeing under many different departments, retains that leadership on paper, but the actual day-to-day grant administration, school implementation, and civil rights enforcement are effectively outsourced. Now, there are many disability rights groups across the country that are denouncing these transfers for many reasons, but they're warning they undermine the core foundation of our federal education and civil rights policy. I put a coalition full statement here if you want to read more on those concerns and the issues that may arise from that interagency agreement. And for all of us here, it is important for Congress to hear from parents, educators, and advocates immediately. Every call and email makes a difference. Another action alert that you can click on here to get involved from the Council for Exceptional Children. This will go to U.S. senators and U.S. representatives. I think the one thing that for all of us is more important is whether or not moving forward with these changes, whether or not we're going to see that our students, those who are involved in special education, our civil rights complaints, discrimination, things that may take the day-to-day part of the school districts when it comes to providing services under special education are going to be impacted. It's important for us to just share our opinions and continue to take action. And another question I've received on this is whether or not this is final. This is why advocacy exists, for us to continue to show and denounce transfers such as this, to continue to show up. And again, it's not lobbying to reach out to your representative and senator and remind them what is the power and authority of Congress. So going back to the former slide and reminding them that these programs and only Congress has the authority to transfer them. And this interagency agreement, it is one concerning, and we don't believe is maintaining what the Congress has put under the authority of the Department of Education to make sure that special education lies under that agency. So the federal restructuring of special education civil rights is extremely important right now. I've seen just in recent news that there are lawmakers on both aisles who are also concerned. So now's the time to continue. We had a national call-in day about a week or so ago, and that seemed to be impactful to get many lawmakers to speak up. And hopefully we continue to do this until we get a more clear response as to what are some of the impacts that are going to be happening on a day-to-day to our families when it comes to special education and to us as grantees under the Office of Special Education and Office of Special Education and Rehabilitation Services. Let me just stop there. I know I'm knocking on the side of my 30 minutes.
Johan, there is one question in the Q&A. Hannah asks, is every state required to submit data for the portal? She's talking about the KFF, the Kaiser Family Foundation Medicaid work requirements. She's from South Carolina and didn't see her state listed.
Let me open it up now, Lauren. Thank you. Now, the portal just mentioned, Lauren, I heard you say it was for the KFF. No, the Kaiser Family Foundation is a tracker. No one really submits or requires anything to the foundation, and anything that they report on, or if the state is not there, they do individual research. So your state just may not have put out information just yet. Again, they do not have to require what data matching sources or other information from these states until January 1st, 2027. So there is time for the states. But again, other states have decided to implement this earlier. Some states may choose to do it a couple of weeks before the implementation date under federal guidance. So that's a good question, and thank you. I did notice some states were missing, but they just haven't put out public information yet. But I do recommend that you either reach out to your state representatives, state senators, your U.S. representatives, and that's something that you can mention in your advocacy. You haven't seen information. You haven't seen how they're implementing. You haven't seen what might be required. What are the state's definitions? And that's something you want sooner than later so you can plan. So very good point to bring up. Thank you for that question. Okay. Let me continue on just the AI update. Moving to AI updates, I wanted to tie this in together because we're just as many policies that have changed or are happening today. We're also seeing artificial intelligence become, if not a center of almost every conversation we're happening, even with the Medicaid work reporter requirements. There has been language on whether or not these states are going to be looking for artificial intelligence vendors in order to quickly create data matching sources to verify exceptions for the work reporting requirements under the final rule. I can't say whether or not that is positive and negative, but I can say that the impact is real, and that may come on to other conversations on policy when it comes to data centers and what states may withhold within state agency data to a consumer's data, what's private, what's public, if we have state agencies sharing medical data with AI vendors, that just opens up a can of worms that we'll need more than 30 minutes to get into. So how AI is changing, for many of us here, I just want to mention two of the bigger things that I've seen. If I go a little quicker, it's just on the brink of time, is you no longer have to download a specific and separate app like ChatGPT to use AI. We've all heard go to ChatGPT, go to Gemini, go to Claude, go to all these other platforms. Now, just if you have a phone, if you have a computer, if you have a Windows, if you have a Mac, it is there. It is implemented. It is what, lack of a better term, hardwired into our everyday. Our TVs have it. Our smart devices have it. Our apps now have AI assistants. Our banks, it's everywhere. You no longer need ChatGPT. You have Cortana, Windows, Apple Mac, you have the Smart Assist, Google, you have Gemini. I can go on and on, but now it's just there. Even phones and smart home devices release new models with almost completely no changes to it, other than they created an AI component to go along with it. Therefore, it's everywhere and it's being installed and it's being part of your updates. And even at work in your bank app, as I mentioned before, you can open up your Bank of America app, Wells Fargo, wherever you decide to do your banking, and you'll notice that there's a smart artificial intelligence assistant there looking at your deposit, your withdrawals, giving you a budget recap. It is a lot that is happening, and very quickly for those who aren't reading up on it. We are seeing now the very monumental change, but for me, I feel it's monumental, is that youth and parents and all of us don't really need to type out questions anymore. We can upload photos now. We can upload, here I put a bus schedule, a job application, a IEP page, and we can now use our voices to ask AI, read this to me, what I need to do next, completely removing typing and reading barriers and the ability to double check what you're requiring from AI. How can we use it? I've mentioned just a couple of things here just to take back with you is be careful with what is considered a PII, which is personally identifiable information into an artificial intelligence tool. This includes youth and parent numbers, your own individual names, numbers as in what may be your numbers where it refers to your phone number, social security. You'll be amazed how comfortable people can get with AI as they go past the whole privacy question. Exact medical diagnosis, specific school names, anything that can locate you. And I just put a tip here because it feels like it's unwarranted, but generalize it completely. Instead of help me with John Smith, who goes to Lincoln High, I put an example here. What are transition best practices for a 16-year-old with a reading disability? Now, if you are using AI or you think back at this and realize I am using AI maybe a little more to a comfort level where I have shared these PIIs, these personally identifiable identifiers, just remember personal identified information, excuse me. just remember that there is the danger of hallucinations that come with AI. Because they're programmed to be helpful and confident, AI will fabricate a response that looks 100% real. And this is called, many of you may not know the term, hallucination. And in a hallucination, I think one of the major examples that we've all know of or have seen is what's happening in the legal profession. But just in recent years, over 1,300 court cases have been impacted by professionals and other individuals who use AI in their legal briefs to determine their argument for the prosecution or defense, and has resulted in massive court fines as well as removal of licenses or complete suspensions from the state's bar when it comes to some of these attorneys. Now, hallucinations means that if AI cannot figure out the correct response, cannot fact check your response, cannot put together one and one, it's going to create a completely new response on the sake of making sure you are a satisfied customer. One of the dangers that exists with tying that with your privacy and your data. So therefore, if you have your data or you've shared it or you're using AI, this isn't to say you can't or shouldn't. That's not where I'm putting myself in the conversation. But I do want to share with you what you can do to turn off data sharing. So I put in the top 3 now currently used by consumers: ChatGPT, Claude, and Google Gemini. But for ChatGPT, if you click on either one of these, I'll click on the ChatGPT one just for now, you can learn a bit more on how to control your data settings when it comes to AI and ChatGPT. Now, ChatGPT uses your data to improve the model for everyone. What that means is that if you have used personal information or you're using information that can be tied to you, they're using the way and responses of your conversation and interactions with AI to improve conversations and responses to that information with everyone who's using ChatGPT. Now, there are ways to turn it off. You can turn off improve the model for everyone with ChatGPT. You can toggle off the model training setting for Claude. And for Google Gemini, you can turn off activity and keep activity. And one of the things for those here who are parent center project directors, executive directors, who are looking for ways to maybe optimize and implement AI in your work, before your staff uses AI tool for work, one of the things you can require is to mandate an opt-out switch on their accounts to protect your organization's internal data. So yes, you can turn it off. Yes, it is an option. And that doesn't mean I can't say or promise that it's 100% your privacy is guaranteed, but it's a step in the right direction when you know that your responses are not being used to feed the algorithm that exists behind these AI models. Now, I do want to mention some silver linings and some of the major improvements and innovations that have come from AI, especially with empowering people with disabilities. AI has now been able to recognize and understand non-standard speech patterns. I put in an article here, but many smart home devices, many emails, many web browsers have used AI in order to support individuals with limited motor control to help with their speech impairments to work remotely and to engage in conversations online as well as conversations in the day-to-day. We also seen AI-powered assistive technologies predict sentences based on the person's personality, based on the person's sort of patterns that they set up with these technologies, and allowing many nonverbal youth nowadays to have real-time conversations. We're seeing communication gaps being improved by almost as much as half, thanks to some of these assistive technologies that have adapted AI. And we're also seeing modern hearing aids being used with AI technology in order to control and isolate background noise. Many of us here are actually using that today through Zoom. If you go through your audio and you check your audio and you go under microphone modes under your audio in Zoom, you'll notice you'll have noise removal, personalized audio isolation. That is the artificial intelligence model used under Zoom webinars and Zoom meetings. Again, you don't know. You're using the technology and it's already there in front of you for the good and for the bad and for the ugly. But for the good here, we are seeing a lot of people with disabilities who use and utilize hearing aids able to use AI to automatically decode that information that comes up to them as well. So just to wrap up very quickly, there are a lot of federal and state laws. Right now, federal that is law is the Bipartisan Take It Down Act. The Take It Down Act, due to explicit content, has been used to cyberbully adolescents. And this Take It Down Act has come into implementation this year, but it creates a process for consumers that are AI have used against them to defraud them, bully, intimidate them, or trick them, have found ways in order to have a public right of action. And that legislation is important to know. So I just want to put this slide here. And then I just want to thank everyone for your time. I know I'm over. So I'm just going to pass it back to the RAISE team and give the time back to the rest of the agenda today. But I'm here for the remaining of the time if anyone wants to put anything in the chat or Q&A. So thank you.
Okay. Thank you so much, Johan. That was great info. As you all know, AI is growing and changing rapidly, but we wanted to make sure that you all got that info because part of AI can also support in your advocacy in learning about policies that are changing. And so if we are not using it, learning it, figuring out what's good for it and what it's not, then we will be left behind. So now we're going to be moving into the presentations by our 8 RSA regions. And we're here as RAISE to support these 8 regions and supporting their families and youth in transition. And so each of the regions will speak for a few minutes and then pass it to the next region. Dawn, you are up.
Hi, everyone. I am here with Megan Chapman, who's from the Federation for Children with Special Needs in Massachusetts. Are you there, Megan?
I am, but my video is turned off by the hosts. If they could turn that back on, that would be amazing.
Hold on, I will fix that. Give me a
Thanks.
So
Thank you.
very quickly, Megan's gonna go first, but we are Region A, A1 and A2. Megan is Region A1. She is the lead in that part of the region, and I am the lead in A2, Dawn Monaco. I am the program director for youth engagement at SPAN Parent Advocacy Network. And go ahead, I'll pass it to you, Megan.
Thanks, Dawn. Hi, everybody. I'm Megan Chapman. I'm the officer in charge of transition to adulthood projects at the Federation in Massachusetts. And like Dawn was saying, we are just Region A, not Region A1 and A2, because we are a collaboration. Rather than compete against each other, we all decided to collaborate and create real transition partners. So that is SPAN Parent Advocacy Network out of New Jersey, FCSN out of Massachusetts. And in New York, we have 3 partners, include NYC, Parent Network of Western New York, and also Starbridge. And what we do is really we're focused on providing written resources, live webinars and recordings of those trainings, technical assistance, and support to youth and young adults with disabilities and their families in Region A by helping to fund and support the parent centers in Region A. I'll let Dawn talk more about that.
Yeah. Did you see my screen by any chance?
Yes, we see it, Miriam.
I can, yeah. If you want to
Okay.
advance
You
to
can
the next one.
advance.
All right. Let me know, and I will advance. Did it move?
Thanks.
Yes,
Perfect.
it did.
Thank you.
Okay, so we want to tell you what some of our activities are in Region A. So we provide 2 webinars a year to families, youth, and professionals. As Megan mentioned, they are recorded and they can be found on the Real Transition webpage, which is on the SPAN website. We can drop that. I think it's at the end of the presentation. So we provide 2 region webinars, and then we also provide a virtual convening. Our convening is basically an extended webinar. So webinars are 60 minutes, convenings are 90 minutes. So we do one virtually. We actually have one on July 29th. I think if I can, I'm going to put the link to that webinar or someone is doing that. So you can sign up for that. And then we also have 2 in-person convenings, which usually take place at our NEPAC, which is our regional Parent Technical Assistance Center in Region A. And so we usually collaborate with the region in the fall and in the spring when they have their conferences. We also develop some resources. We have 2 to 3 fact sheets a year that we develop, and there's a link at the end here so you could access those fact sheets. We have a monthly e-newsletter that anyone can sign up for, and that also, I believe, is at the end, so you can sign up for that. It's all things transition. Not only does it provide you with lots of resources, it will provide you with some activities at the bottom of the newsletter. And then we also provide social media posts to all the centers in the region for them to put them up on their platforms. We have Transition Tuesday and we have Workforce Wednesday, and all those posts are developed by the youth and young adults that we work with in the region. And in a couple slides, I'll tell you who they are. You can go ahead, Miriam.
Thank you. So yeah, one of the other things that we do is we provide technical assistance to all 25 of our parent training and information centers and CPRCs, and that's on transition and developing youth engagement in their states. And that is for all 14 of our states. We support and fund each center. So not only are we a coalition of 5 parents training centers sharing funding, we share funding with every parent center in our region. And what we're funding them to do is first develop an annual action plan each fall for how they're going to implement their work, and then provide data on the transition work that they did complete during the year. They also submit to us at least two statewide post-secondary transition webinars, and also 2 written resources, half as many for the CPRCs, 1 each for them. And then we are also in the midst of a needs assessment for our PTICs and CPRCs to find out what other technical assistance they would like. We think it's leaning toward a monthly newsletter, but we'll see. And we also share some of our funding with community-based organizations through mini grants each year, except the first year we fund 3 projects. This year it's 2, and the 2 states are New Hampshire and New York. One's a financial literacy program, very innovative actually, and another one's a series of community and employment opportunities that we're going to end up with some reports and share at a NEPAC event in a showcase in March. We'll be able to rotate through all the states in Region A throughout the 5-year grant by doing 2 or 3 a year. And we also support youth programming, and I'll let Dawn talk about that. You can advance the slide.
Yeah, so we provide funding to all the centers in the state, $1,000 aside. In addition to the funding that Megan just mentioned, we do provide $1,000 to each parent center in the region to help facilitate their youth work at those states. So they can use that funding for whatever they see fit, whether it's to stipend young people, to advise them and collaborate on resources, or whatever it is that they need to use that funding for so that they can involve more youth at their centers. And we also have what we call our Youth Leadership Council. So that is a collaboration with the NEPAC, which again is the Regional Parent Technical Assistance Center. And so we collaborate with them to build this Youth Leadership Council. That council is made up of around 23, it varies, young adults who are actually connected to the parent centers in Region A. So it could be that they occasionally are stipend to work with the center. It could mean that they're young adults that are actually employees of the center. So it's a varied group of young people. And when we first started this group, they would meet quarterly with our staff at SPAN, our young adult staff. But now they meet monthly because it's grown so much. And they meet to discuss resources that they themselves have developed in their state, activities, or any information that they have that they're working on. And they also kind of bounce ideas off of each other. And it's a wonderful way for these young people across the region to really collaborate. We've had them present at conferences within the region and within other regions. So it's a wonderful way for them to really learn. And we provide them with some professional development as well. Once a year, we bring in an outside agency to present to them on topics that they want to have information on. They've identified topics. And so I mentioned that they also collaborate on regional and national conferences. They've presented actually at the Region B conference in April. We had one young person from the Virgin Island Parent Center, and it was wonderful, and it was great for them to see some of the staff and youth from other regions. And then we also have what we call our collective impact work group. So there are several work groups within our regional and within the region through the NEPAC, and we have a collective impact group on transition. So we meet quarterly, and that consists of not only staff from all the region centers that work on transition, but also youth leadership council members will also be in attendance at those meetings. And we meet quarterly.
Love it. We can advance that slide, please. Awesome. And then this is our last slide. See, we're very busy. I can't wait to hear all of what everyone else is doing. And I hope you're able to take some of our best practices as well. If you want to get any more information about Real Transition Partners, there's a link. I've shared it in the chat, all of these. Our fact sheets, you can find links there for some written resources. We also have recordings of webinars that were current and archived trainings that we've provided. You can find those at the third link. And then for social media resources, those Transition Tuesday and Workforce Wednesday materials, you can feel free to find them on SPAN's Facebook page or the Federation's Facebook page, and you can just forward them onto your own page. That's great too. We're happy to spread the wealth. So thank you so much.
Thank you.
Hello, everyone. It is I, Kendra Wormley, with PETC, Parent Educational Advocacy Training Center. And I will be talking about Region B1, which includes Florida, Georgia, North Carolina, South Carolina, Tennessee, and Virginia. So we have kept with the same name of Ways to Adulthood for our second cycle with this grant. During the process of this grant and over the years and with the cycle, we do meet with our state partners. We meet with each other as a group quarterly, and then we also meet one-to-one quarterly as well. If you can go to the next slide, please. Our focus for this year, we always pick a theme or focus for every year. And for this year, it is competitive, integrated employment. So we thought it was very important to talk about the importance of competitive integrated employment, or CIE, with our parents and professionals, and also with the students or our youth that are in our region of B1. We know that employment is very important, and having the information and knowledge and how to navigate those systems is also very important to the people that we are sharing this information with. Next slide, please. So within the topic, we provided an overview of, as you see on the screen, about the Rehabilitation Act programs. We talk about how that connects with transition to adulthood processes. Also, we talk about the available supports as families are navigating through CIE, providing a definition of CIE, and talking about those myths, those fears, and the benefits that come with CIE. We also talked about barriers, because those fears that are there, those are also our barriers, but also coming up with those solutions and how those solutions can possibly support that student to achieve their ultimate goal, and talking about alternative pathways to independence as well. Next slide. So we kept with the same, I like to say, process per se, as we did with cycle 1, in providing parent professional trainings along with youth trainings. So with the parent professional trainings we did an online self-paced course for parents and professionals for every state. So it was state specific for those states to receive that information and how to navigate CIE in their state. These trainings took place the beginning part of March to the beginning part in April. So we're talking about a month open for families to be able, and professionals, to access the course on their time and be able to take it when it was convenient for them. Next slide, please. We utilized the Thinkific online system, that's the word I was looking for, sorry about that, to provide the self-paced course. And at the end of the course, if one completed it, then they also received a certificate of completion. Also within the training, the states, their deliverables included for them to provide a parent professional training that's either going to be in person or that would be virtual as well. So each state will have an opportunity to receive this training twice. Next slide. In keeping with the same fashion of providing the trainings, we also provide ways in Espanol. So we provided that information about CIE to our Spanish-speaking families. This training took place in March, and we had over 20 participants for this training and had very great feedback. Next slide. As I mentioned before, there were the youth trainings that took place. So this was provided multiple times. Twice was PTC led that training and we opened it up to all states within the B1 region. We had a combined total of 45 students who participated in these virtual trainings. And then for the deliverables for each state, they had to conduct, because they're still in the process of doing these trainings, a youth training that could either be in person or virtual as well, and then provide that feedback survey results back to PTC. Next slide. Something that we did differently this year is that we added in additional trainings. So one of those trainings is building effective communication and advocacy skills training. And this was offered to parent professionals in English and in Spanish. And it was also offered to our youth as well. As a collective, these were virtual trainings that took place. And the purpose of it is that we focus on the importance of communication when it comes to planning for the future. We know that everyone is working collectively for the good of the student and their future. And how can we better make these connections and build upon these connections for our young people? All these trainings were held virtually, and we had over a total collectively 85 attendees for these trainings. Next slide. The other training that we did is AI, artificial intelligence. This is like a hot topic, I feel, in a lot of our worlds as it's all coming to a head. And for me, it feels like it's in my face sometimes. But no matter how we feel about AI, whether it's good, bad, or indifferent, the thing is that we can utilize AI to help us to navigate the systems and to also prepare for adulthood. And that was the focus of these trainings. With these trainings, also, we provided it in English and Spanish for parent and professionals. And we also had a youth student training as well. With those trainings, we had over 80 participants collectively for those trainings. Next slide. So far for year one, when it comes to training, as of May 31st, there have been over 265 parents who have been trained, 157 professionals, and 99 youth. This will include those that we connected with virtually, and also that self-paced course that was offered as well through Thinkific. Not only did we have the trainings, but we also developed 30 resources around the topic. We have state-specific resources around competitive integrated employment for every state, for parents, and also for our youth, and provided a visual fact sheet for our youth as well. And then we also developed fact sheets around artificial intelligence and communication, and as we can use that to prepare for life after high school. So I think I may have come to my 5 minutes. Hopefully I did not go over, but thank you guys so much for this time, and thank you so much for your energy as I shared about what we have going on for Ways to Adulthood with PTC and Region B1. Thanks, guys.
Gina, are you there?
I am. I'm just not able to turn on my camera.
Gina, I'll go into it and see if I can fix it. But please go ahead whenever you're ready.
Okay. So we are Region B2 RSA PTI Independent Futures at Work. I'm the executive director of our center that operates the program, and Katrina Wellborn is our project director. She's also on today with us. Go ahead, Miriam. Okay. So the Independent Futures at Work project, we are Alabama Parent Education Center hosts the grant with a slew of partners throughout Region B2. We partner with both the PTI and the CPRC Parent Centers in Alabama, Mississippi, Louisiana, Texas, Arkansas, and Oklahoma. Our goal is to work to ensure that individuals with disabilities and their families have the skills and knowledge necessary to effectively advocate for vocational, independent living, and other rehabilitation services. Go ahead, Miriam. So, what we wanted to talk about today, something specific that we've developed as part of our goal is a series of conversational guides. So, because we knew that transition planning is essential, because we know that early connections to good adult-based transition services and supports improves the outcomes in vocation, student independence, and their education, and because we know that work matters for all individuals, and parent center staff across our region play a really critical role with access to families because they already have trusted relationships with those. So our project tools, the conversation guides, are developed to support meaningful, consistent conversations with families throughout the region, informing them on resources and access. Okay, Miriam. So when we talk about the conversation guides, go ahead, Miriam. The conversation guides were developed to basically introduce the topics and supports to families, because what we know, the earlier those conversations happen, the more concise the conversations are, the less families and youth are asking later, well, why didn't I know about this sooner? So that's a lot of what we've heard, and the reason why we develop these developmental introductory conversations that all parent center staff across our region can utilize. They're designed to increase the knowledge of both families and the parent center staff, because we know that parent center staff across the region are very much like other different places of employment. We do have staff turnover, and a lot of times they're asked to give access to information that they may not fully understand themselves. So each of the conversation guides develops an introduction to the topic that's going to be discussed, where it comes from, the basis, and the importance of making that connection. The conversation can be had and help families have an accurate knowledge of work and adult supports in a timely manner. So you're going to have a very different conversation with a family who has a 12-year-old versus someone who has a senior in high school. And so the conversations can get more in depth versus like the introduction to the very need to think about work and what that might look like versus the intricacies of actually accessing a VR service, applying for your SSI. They're all time-based. All conversations are delivered in 10 minutes. So they're designed to be very concise conversations, not something that overwhelms anybody, but broken into small enough chunks where they can be introduced in the time when it's necessary to have them. Okay, Miriam. So the parent center staffs across our region, they integrate the conversations into individual assistance with families and or youth, or even professionals working with particular families when they have questions. Some of our centers are integrating them directly into workshop and training curriculums where they can have specific introduction and utilize the material to do that. And it's a great way to have a conversation with the family at a public awareness event. So when we're at different events, we're able to take these conversations and have them directly with individuals face to face, giving them meaningful concepts at different places where they're able to go back and utilize them or think about them. So the different topical areas, and we have different conversations in each of these areas, include transition planning, adult services, vocational rehabilitation, and then continuing your educational options. So all of those different topics that we have discussions and conversations around center into these 4 different topical areas. Okay, Marian? So each conversation guide is going to include an introduction to the content to develop and inform the Parent Center staff's knowledge of the topic being discussed, a scripted conversation to introduce and explain the topic, and then an evaluation reporting tool once the conversation has occurred with the youth and or their parent and families. And so that's really our focus in helping to create good conversations across our region, across various topics. So Katrina and I are here to answer any questions you may have or be happy to talk with you outside. Thank you, Miriam.
Thank you, Gina. And do we have Sue?
Yes,
Yeah,
and
you.
Judy. Judy
And
Moses should be here as well, my colleague. It's just so exciting to hear all the different things that all the states are doing. I'm just so pleased to be part of it. So I'm Sue Fager with Pacer Center in Region C1. And next slide, please, Miriam. Our partner states, I have all their icons on here. New to this grant cycle for us is ALAS in Milwaukee, the state's CPRC. So it'll be really exciting to see what they bring to our grant. Next slide, Miriam. So the focus of Project Launch, like I think almost everybody's, is developing resources. Oh, I lost my notes, you guys. Our focus is on helping youth and families with disabilities reach their post-secondary educational, employment, and independent living goals through training, assistance for youth, families, and professionals, and development of resources. So for our year 1 activities, and it's really hard to just pick 4 because everybody is doing so many incredible things. But each state in our region develops their own state plan, has their own budget, and focuses their work around a underserved community within their state. One of our objectives at PACER for this year is continuing our collaboration with Voc Rehab, State Services for the Blind, Centers for Independent Living, American Job Centers, Workforce Centers, whatever your state calls them, and other community-based organizations, because we are finding that we can be a key for families who are struggling with who are those adult service agencies, what do they do, and how do we use them? As a result of our collaboration, we're also having in-person meetings with those partners across the state to both expand our understanding and help families access them as well. Really excited to get out to transition resource fairs and talk with youth and families directly, just to see what's working and what isn't working in their part of the state. And then we are also focusing our efforts on outreach and collaboration with Minnesota's 11 tribal reservations and communities. And next slide, one area we're focusing on is employment. And so we designed a 3-part workshop series with three different collaborating organizations, each taking a different piece of it. I've included a link to register. We'll be talking mostly about Minnesota resources, but I think the information presented will be relevant. Judy and I are here if anyone has any questions. Thank you.
Thank you, Sue. Okay,
Thank you, Sue.
C2.
We have Karen, I think.
Okay, hi everybody. Oh, it looks like the slide shifted a little bit and the line is a little bit in your way. Sorry about that. It didn't look that way when I first created it. So I am going to talk about Region C2, which is a technical assistance initiative. Region C2 isn't currently funded on its own, so it's a partnership with technical assistance, and the design leaders from that are the folks from RAISE. So Don and Josie have been working closely with us. I'm Karen Thompson from Ask Resource Center, and I'm the regional liaison for the group. And then Families Together in Kansas is the youth leadership experts. And then you can see our Region C2 states there: Montana, Wyoming, the Dakotas, Nebraska, Kansas, Missouri, and Iowa. We are all PTIs. There are not any CPRCs in this part of what is the total PTAC Region C2. So let's move to the next slide. I'm going to try to speed up for you guys. So this just gives you an idea of the snapshot of the fact that we're very rural and frontier states. We connect the Midwest High Plains and the Rockies. And our work is focused on coordinated efforts to bridge together the centers, youth leaders, share resources, amplify promising practices, and building lasting partnerships in hopes that we'll be moving forward in the coming year as a region. Next slide. So as the liaison, one of the projects that I'm responsible for coordinating is making sure that the national resources are shared, regional updates are shared, and there's some basic technical assistance to our state. We also facilitate monthly regional coordination meetings, and I'll talk about more about the depth of what's in those meetings in a future slide. And then tracking some outcomes in progress to monitor the work scope and the deliverables, which are smaller than they are for the rest of you. We've got little bits of money here and there for the different things that we're working on, but the overall budget is shoestring comparatively. So I think we've got a lot of things going on for the amount of dollars that we're working with. Next slide. One thing is a regional resource repository. So we've developed a platform for that. Ask took responsibility for that. Each state is going to be populating 10 resources. Iowa's are already in there. Some other states are getting moving on theirs as well. Because we're not funded with these dollars right now, these are resources that the centers have created from other funding streams, but they will be placing them together in this repository around each of the categories that are priorities for the RSA funding. So the individuals living, self-advocacy, post-secondary transition services, and so on. They populate with each of those by the time we're done. That's 80 resources. And then that is on a sheet that can be toggled and looked at by topic, by resource type. Is it a video? Is it a brochure? And also by state. So we can each share those across our region. Next slide. We have peer sharing going on. That got started a little bit late and was thanks to the folks at RAISE listening to us tell them some of the things that we wanted to work on. So we got a little bit of a late launch with that. The first one has been accomplished, and the next 5 states will go share their peer sharing with each other over the course of the next 3 months. It's spotlights during our monthly coordinated meetings where each of those states takes time to share a state level product, service, or tool. And they're practical ideas and templates that the rest of us could immediately replicate. That's going to provide us with additional information to add to the repository I was talking about before as well. Next slide. The Regional Youth Advisory Council is the last of those 4 things, and this piece is led by Families Together in Kansas. 6 states out of our 8 are participating in this. It includes monthly Youth Advisory Council meetings. Many of us have our own in our state, but this is our regional come together. Those are virtual until September, and then in September, Kansas City's council is called Chase. We don't all have to be called that. We all have our own names, but we're coming together for their Chase Fest in Kansas City in September to give all of us an opportunity for our youth and young adult leaders to meet in person. So if you're interested, these are some of the intended outcomes of the technical assistance work that we've been doing. And I'll just skip to that very last box at the bottom that says develop a broad regional and national alliance. As we look forward into future years, if you've heard something that we're working on that you would like to be a part of, or you think you have a tool that you would like to share with us, I've been taking notes from the rest of you, things that I might reach out and ask you for. But we would love to collaborate across regions. We're, of course, already doing that robustly with RAISE and also with Region C1. So excited to work with the rest of you going forward.
Thank you, Karen. Thank you.
Hi, can everyone hear me? Yeah.
Yes.
Okay, so I know we're speeding on time, so I'll probably skip through a couple of slides, but thank you for the opportunity to share. This project, my name is Yasmin Butler. I'm with PAVE. This project is led by PAVE in partnership with FAC Oregon. Our region also includes Hawaii and Alaska. This project was created to strengthen transition services across our region by bringing parent centers together to learn from one another rather than working in isolation. This is cycle 1 for us for this grant. Our goal was simply make high quality transition information easier for families and youth to access while reducing duplication of effort among the parent centers. Next slide. Who we serve. From the beginning, we intentionally centered communities that often face the greatest barriers to transition planning and services. That includes rural and remote communities where services may be hours away, tribal communities whose cultural values and local resources should be reflected in their transition planning, military connected families. Washington is a state that has a huge amount of of military families. And then historically underserved and marginalized communities. Rather than creating resources for communities, we work to create resources that can be adapted within the communities. Next slide. Just trying to make sure we're in the right space. Okay, this slide. Our first major accomplishment in the Region D1 is the website. Which will be live next month. This website serves as one regional hub where families, youth, educators, professionals can quickly locate trusted information. It will include universal transition resources application applicable that's across the region, state and territorial Pacific information, national organizations. Most importantly, the website, we are designing and building a website to be updated. We can update the resources that evolve and allow parent centers to customize information. So we'll have templates that could be usable and spread around the region. Next slide. Highlight number 2 is we just finished our first draft of the D1 Transition Planning Toolkit. This toolkit was designed with one guiding principle. Transition planning should happen with youth, not to youth. So it uses plain language, interactive activities, and fillable worksheets to help young people think about their strengths, their interests, education after high school, career exploration, self-advocacy. This toolkit was designed to enable the youth to be more active in their transition planning. And so our hopes is that this could be used during transition IEP meetings, pre-eds, DDA, VR, tribal VR. So it will take them through, starting at 14, take them through all the way through high school and beyond. So highlight number 3, next slide. This is the most exciting one, is that we are investing in D1 parent centers all around, which includes our CPRC in Alaska. So rather than prescribing one statewide activity, we encourage each center to identify what would have the greatest impact in their community. This approach recognizes that local organizations know their families best. So, for example, we have links, the CPRC from Alaska. They will be hosting a transition resource fair. Fact Oregon will be co-hosting the Oregon Self Advocacy Coalition Conference, and Parent Center Hawaii, Leadership and Disabilities Achievement of Hawaii. That's the name of the Parent Center, the full name of the Parent Center is they will be providing virtual and in-person transition learning labs. So although each of these projects look different, they all contribute to the same regional goal. So improving transition and outcomes for youth. So that's what's been most, that continues to be the most exciting part as we shift out of this first year of us and the heavy lifting of building and making the connection and collaboration. So year two, we hope to really be able to show you how much we have expanded and built on. So that's all. I won't go to the last slide, so you can.
Okay, perfect. Thank you so much, Disney. We are going to actually wait to talk about the Power Project to next week on Monday. This whole session and summit starts 1 hour earlier than when you started today, and I hope you can join us. We will start with a welcome and Keith sharing their project, and then we will move into some of the youth work that's been going on and accessibility issues. So we are so grateful for all of our speakers and for all of you attending. Thank you all, and we'll see you in a week.